Epilepsy is a neurological disorder characterized by recurrent, unprovoked seizures. Seizures occur when there is sudden, excessive electrical activity in the brain, leading to a variety of symptoms, such as abnormal movements, behaviors, sensations, or loss of consciousness. Epilepsy can affect people of all ages, and its severity and impact vary greatly between individuals. Causes of epilepsy. Epilepsy can have various causes, though in many cases, the exact reason remains unknown. Common causes include genetic factors. Some types of epilepsy are linked to specific genetic mutations, which can be inherited. Brain injury or trauma. Head injuries from accidents, falls, or sports can lead to epilepsy. Stroke. Stroke can damage brain tissue, leading to the development of epilepsy, especially in older adults. Brain infections. Infections such as meningitis, encephalitis, or neurocysticercosis caused by parasitic infections can trigger epilepsy. Developmental disorders. Conditions like autism or neurofibromatosis are sometimes associated with epilepsy. Prenatal injuries. Brain damage that occurs before birth due to infections, poor nutrition, or oxygen deprivation can result in epilepsy later in life. Tumors or structural abnormalities. Brain tumors or abnormalities in brain structure can lead to seizures. Types of seizures. Seizures in epilepsy are classified into two main types: focal partial seizures and generalized seizures. 1. Focal partial seizures. These seizures begin in a specific area of the brain and can be further divided into focal aware seizures, also known as simple partial seizures. The person is fully conscious and aware but experiences unusual sensations, such as tingling, flashing lights, or smells. Focal impaired awareness seizures, also called complex partial seizures. The person has altered awareness and may appear confused, dazed, or perform repetitive movements like lip smacking or hand wringing. 2. Generalized seizures. These involve both sides of the brain from the onset and can cause loss of consciousness. Types include tonic-clonic seizures. Grand mal, the most well-known type. These involve loss of consciousness, stiffening tonic phase followed by rhythmic jerking clonic phase. They may last several minutes. Absence seizures. Petit mal. These are brief episodes, often just a few seconds, where the person zones out and appears to stare blankly. These are more common in children. Myoclonic seizures. These involve brief, jerky movements in specific muscles or muscle groups, often occurring in clusters. Atonic seizures, also called drop attacks. These seizures involve a sudden loss of muscle tone, causing the person to collapse. Tonic seizures. These cause stiffening of the muscles, usually in the back, arms, and legs, often leading to falls. Clonic seizures. These involve repeated, rhythmic jerking movements without the stiffening phase. Symptoms. The main symptom of epilepsy is recurrent seizures, but the nature of these seizures can vary widely. Common symptoms include temporary confusion. A person may appear disoriented after a seizure. Staring spells, often seen in absence seizures, where the person may seem disconnected from the surroundings. Uncontrollable jerking movements. These may affect the arms, legs, or entire body during tonic-clonic seizures. Loss of consciousness. This may occur in various types of seizures, especially generalized seizures. Emotional or sensory disturbances. Some people experience unusual feelings, smells, or emotions just before a seizure, known as an aura. Diagnosis. Diagnosing epilepsy involves a combination of medical history, seizure descriptions, and diagnostic tests to rule out other causes of seizures and determine the type of epilepsy. Medical history and physical exam. A detailed history of the person's seizures, family history, and general health is taken. Electroencephalogram (EEG). This test measures electrical activity in the brain and can detect abnormal patterns that suggest epilepsy. Imaging tests. Brain imaging, such as an MRI or CT scan, can help identify structural problems, such as brain tumors or scarring, that might be causing seizures. blood tests. These may be used to look for infections, genetic conditions, or metabolic disorders that could be contributing to seizures. Video EEG monitoring. Sometimes, the person is admitted to a hospital to be monitored with EEG and video recordings to capture seizures for diagnosis. Treatment options. While epilepsy cannot always be cured, it can be effectively managed in most people with treatment. Treatment options include 1. Medications. Anti-epileptic drugs or AEDs. AEDs are the most common treatment for epilepsy and help to control seizures by reducing abnormal brain activity. There are many different types of AEDs, and finding the right one may take time, as some people respond better to certain drugs than others. Common AEDs include levetiracetam, valproate, carbamazepine, lamotrigine, and phenytoin. Side effects can include fatigue, dizziness, weight gain, and mood changes, so regular follow-up with a healthcare provider is important. 2. Surgery. Surgery may be an option for people with epilepsy that doesn't respond to medications. It involves removing the part of the brain where seizures originate. Resection surgery. Remove the area of the brain where the seizures begin, such as in cases of temporal lobe epilepsy. Laser ablation, the less invasive procedure that uses lasers to destroy seizure-causing tissue. Corpus callosotomy, the surgery that cuts the connections between the two hemispheres of the brain to reduce the spread of seizures. 3. Vagus nerve stimulation. VNS. A device is implanted under the skin of the chest and connected to the vagus nerve in the neck. It sends regular electrical impulses to the brain to help prevent seizures. 4. Responsive neurostimulation. RNS. This device is implanted in the skull and detects abnormal brain activity, delivering electrical stimulation to stop seizures before they start. 5. Ketogenic diet. The high-fat, low-carbohydrate diet can be effective for some people, particularly children, in reducing seizures when medications are not effective. 6. Deep brain stimulation. DBS electrodes are implanted in specific areas of the brain and deliver electrical pulses to regulate abnormal brain activity. Living with epilepsy. Lifestyle modifications. People with epilepsy may need to avoid certain activities, such as driving or swimming, until their seizures are well controlled. Adequate sleep, stress management, and avoiding seizure triggers such as flashing lights or certain medications can help. Emotional support. Epilepsy can impact quality of life, leading to anxiety, depression, or social isolation. Support from family, friends, or counseling is often helpful. Safety measures. Taking precautions to prevent injuries during seizures, such as patting sharp furniture corners or avoiding potentially dangerous activities, can help reduce risks. Prognosis. Most people with epilepsy can manage the condition successfully with treatment and live normal, fulfilling lives. For some, epilepsy may be lifelong, while others may eventually outgrow the condition or achieve long-term remission with medication. Conclusion. Epilepsy is a complex condition that affects individuals differently, but with the right treatment and support, most people with epilepsy can lead full and active lives. Advances in medical treatments, surgeries, and lifestyle adjustments provide hope for effective seizure management.